Hi everyone, I am Dr. Shantanu Sharma and today it's my first video in English. Today I will be discussing about prenatal genetic counseling, screening and diagnosis. It's an important issue to discuss. Why? Why? Because of the rising prevalence of genetic abnormalities in the children. So let's first understand how common this problem is. You will be surprised to know that 3% of all newborns are having some of the other genetic abnormality across the world. In fact, 5% of all stillborns have some of the other genetic abnormality. Majority of the first trimester miscarriages are because of some of the other genetic abnormalities. Even in India, this is quite prevalent. 1 in 1,000 births will be suffering from Down syndrome. Even beta thalassemia is prevalent among 4 to 5% of births. And 4 to 5 per 1,000 births will be having a neural tube defect, which is like an encephaly, that is without having a brain, or having some of the other defects in the spinal cord, like spinal bifida. So, prenatal genetic counseling is all about detecting and identifying couples who are at an increased risk of giving birth to a child with a genetic abnormality. So couples need to be communicated, need to be counseled about information on genetic abnormalities. Women's or couples' risk of giving birth to a child with a genetic abnormality need to be assessed based on their age, based on their ethnicity, based on their race, based on their personal history, or based on their family history or consumption of particular drug. So let's first now discuss which couples are at an increased risk of giving birth to a child with a genetic abnormality. So mothers who are pregnant at 35 or more than 35 years of age. Women who have a family history of giving birth to a child with some neural tube defect or some genetic abnormality. Or a woman who has a previous child with a neural tube defect or some other genetic abnormalities. Women who had undergone some recurrent miscarriages. Even women who have oligohydramnios or polyhydramnios, which means the fluid in the amniotic sac is either lower than the normal levels or more or higher than the normal levels. In mothers, their fetus is not growing properly in the womb or their growth is restricted, that is having a fetus with intrauterine growth retardation. Or mothers who are having uncontrolled diabetes mellitus during the periconception period, or mothers who are diagnosed with some abnormal findings during the blood screening methods. So women or couples who have one or the other risk factors, they need to be screened for these genetic disorders, and if they're found positive on the screening method, they need to undergo a confirmatory or diagnostic method. So in the first trimester, women can undergo the following screening methods. Number 1, the nuchal translucency test. Now this test can be performed between 11 to 14 weeks of pregnancy. But what is this test about? So in the ultrasonography, the fluid-filled space between the fetal skin and the underlying soft tissue, that is in the fetal neck region, if the diameter or the thickness of that fluid-filled space is more than equal to 3 millimeters, then it is a positive test. So a woman who is found to have a positive nuchal translucency test on ultrasonography should undergo a fetal echocardiography as well. Another screening test is the fetus is not having a nasal bone. So apart from nuchal translucency test and the nasal bone absence, the woman can undergo 2 more tests in the first trimester. Yes, that is the levels of beta human chorionic gonadotropin. If the levels are raised, it is indicative of a fetus suffering from Down syndrome. Another test called as PAP-A, Pregnancy Associated Plasma Protein A. If the levels of PAP-A are decreased, it is indicative of a genetic abnormality like Down syndrome. So if any of these tests are found positive in the first trimester, they need to be confirmed or there are repeat measures to be done in the second trimester. So in the second trimester, somewhere between 15 to 22 weeks of pregnancy, mothers can undergo other screening methods, one of which includes the measurement of maternal serum alpha-fetoprotein levels. So if maternal serum alpha-fetoprotein levels are raised, that is more than 2.5 times or 2.5 multiples of medians, then it is quite suggestive of having a child with some neural tube defects. And if the maternal serum alpha-fetoprotein levels are quite raised, then the mother should undergo another high-resolution ultrasonography or amniocentesis. Similarly, if the maternal serum alpha-fetoprotein levels are decreased, then they are quite suggestive of having a miscarriage or a neonatal death or a stillborn child or a child with a Down syndrome. The other screening methods include the measurement of dimeric inhibin A levels and the measurement of unconjugated estriol levels, and their levels are decreased in fetuses with Down syndrome. So, mothers who are at increased risk of having a child with the genetic abnormalities or who had any of those risk factors, they should consult a gynecologist or an obstetrician or the doctor, and they should undergo a combination of these tests, which include nuchal translucency test or the presence of nasal bone or the levels of maternal serum alpha-fetoprotein or levels of beta human chorionic gonadotropin or levels of dimeric inhibin A or unconjugated estriol levels. So various combination of these tests could be performed, and the maternal risk of having a child with a Down syndrome baby can be assessed. And if these tests are found positive, the mother should undergo a confirmatory diagnostic test. So, if any of these screening methods are found positive, then mother should undergo confirmatory or diagnostic test, that is through fetal karyotyping. And it can be performed either through chorionic villus sampling or amniocentesis or percutaneous umbilical blood sampling. So, chorionic villus sampling can be done between 10 weeks of pregnancy until term, and the results can be obtained within 24 to 48 hours. And if the doctor or the gynecologist is seriously thinking about terminating the pregnancy, it can be easily done within the first trimester. Amniocentesis is generally done beyond 15 weeks of pregnancy with the help of ultrasonography. It normally takes 3 to 4 weeks for the results to come. So if somebody is found positive, the abortion or the termination of pregnancy can only be done during the second trimester of pregnancy, which at times can be a bit risky. The third invasive procedure, that is chordocentesis, it can be done between 18 to 20 weeks of pregnancy, and generally a needle is inserted through mother's abdomen to obtain fetal blood cells. The results can be obtained within 24 to 48 hours, but again, the termination of pregnancy, it can only be done during the second trimester. So these tests, as I just mentioned, chorionic villus sampling or amniocentesis or chordocentesis, they are invasive procedures and have some of the other mild risks. But there are some non-invasive procedures nowadays. For example, cell-free fetal DNA method. The cell-free fetal DNA method, in this method, the fetal DNA can be obtained from maternal cell-free DNA, and this can be used to diagnose Down syndrome. Another non-invasive method can be intact fetal cell method. So intact fetal cells can be obtained from maternal blood using some very advanced technologies like fluorescent in situ hybridization technique. Similarly, for beta thalassemia genetic abnormality, mothers need to be screened during the periconception period using various RBC indices or hemoglobin variants. Mother's blood need to be taken and screened for various hemoglobin variants. If one or the other spouse is found positive, it needs to be confirmed through chorionic villus sampling. And if the couple is found to be the carrier of beta thalassemia trait, then the termination of pregnancy can be performed with the suggestion of the doctor within the first trimester itself. So today we discussed about some of the common genetic disorders in India, primarily Down syndrome, beta thalassemia, and neural tube defects. I just mentioned that how prevalent they are, and the woman or the couple need to be screened if they are having any of those risk factors. So it is highly important that you talk to your doctor or the gynecologist about these genetic disorders. If you're having any of those risk factors, you should be screened for any such genetic abnormality in your fetus. I will come back to you with another video with more details about prenatal genetic counseling and what can we do to avoid having a child with a genetic abnormality. This video will also be uploaded in Hindi very soon. Till then, thank you everyone taking out time to listen to my video. Please do not forget to like my video and subscribe my channel. Until then, bye-bye.